Alright, so here we have Dr. Jamie Mark of Northwest Neurological. We're going to ask you a few questions about Parkinson's disease to let the kids know about what's going on. So, what is Parkinson's disease?
So, Parkinson's disease is a neurodegenerative neurologic disease that mainly affects people's muscles in that they can be slow or stiff. They can sometimes have tremor where their hands or their legs shake, and they can have difficulty with walking or balance. We know that the disease is due to death of dopamine cells in the brain. What we don't know for sure is what causes the cell death, but when patients have on average 70 to 80% cell death, they start experiencing symptoms of Parkinson's disease.
Alright, cool. So then, what is the DBS, Deep Brain Stimulation surgery, do?
So deep brain stimulation, there are actually a couple of theories on what it does. We're not exactly sure what it does, but what we think that it does is by implanting a lead deep into the brain, into the subthalamic nucleus, that by creating an electrical field, we are either overriding the cell's kind of hyperactivity, or we're maybe establishing a more normal cell firing pattern in the brain to reduce some of the symptoms of the Parkinson's. What's interesting is we don't believe through deep brain stimulation that we're affecting dopamine in any way, but we think we're hopefully regulating the cell activity to a more normal pattern.
Alright, so then right here you have this little controller right here connected to his battery in his chest that controls the probes in his brain, which control the dopamine and all that stuff. So then, let's see what happens when you turn this off. Right now, he seems to be doing pretty good.
So right now
shaking.
it's on. What I'll do to start with, when I am looking at someone's battery, I first have to have my programmer make contact with the battery, and it's able to do that through clothes or skin or whatnot. It uses what's called telemetry to create a signal and obtain the information that's held inside the battery. So the first thing I have to do is interrogate the battery and pull it up to read the initial settings. Once I've done that, we can turn the device off. Now with the device on, you can see that the hands are nice and relaxed. There isn't a lot of shaking. Go ahead, John, and open and close both hands. You can see the movement is fast and coordinated and what we call good amplitude, which means good size of movement. Very good. And then let's go ahead and turn the device off. John has a battery that both leads in the brain plug into, so if I turn it off, I'm turning off both leads. So if we turn the device off, you can see pretty quickly tremor in the left hand. John, how else do you feel with turning it off?
I feel a sensation in my head.
Sensation in your head?
Just instant sensation, it goes away.
Okay. And with both hands, can you again try opening, closing? You can see this time when trying it, there's hesitation, there's reduced amplitude, and it's evident there's more difficulty with an action just such as opening and closing the hands.
Mm-hmm. And there is no cure for this disease yet?
Not yet, but it's certainly being worked on. Both a cure, obviously, we're very hopeful for, but also the potential to slow the progression of the disease. Mm-hmm. That's another goal for treatment.
Okay. So yet that this DBS stops the symptoms for a while, but it doesn't stop the progression.
Right. So with deep brain stimulation, our goal is to treat some of the symptoms of Parkinson's disease like tremor, slowness, stiffness. But from what we know at this point, it is certainly not a cure, and it's not neuroprotective. It does not slow progression of the disease.
All right. Well, thank you very much.
You're welcome.